6. Natural ways to lower blood pressure. Lifestyle changes critical to proper BP control. 1 in 3 U.S. adults has high blood pressure, according to the Centers for Disease Control and Prevention. This means the force of blood pushing against their artery walls is too high, which can damage the arteries and greatly increase the risk of heart attack, stroke, heart failure, and kidney failure. Lowering systolic blood pressure to a maximum of 120 millimeters of mercury has been shown to reduce these risks. There are 2 ways to accomplishing this: lifestyle changes and medications. While some people can lower blood pressure with lifestyle changes alone, the 2 approaches are complementary. Blood pressure management is 70% lifestyle and 30% medications. If you don't make lifestyle changes, don't bother taking blood pressure medications, because they won't work effectively, says preventive cardiologist Luke Laffin, MD. 1. Eat less salt. Cutting your salt intake is probably the most important way to lower your blood pressure. Studies have shown that a low-sodium diet has the same effect as 1.5 to 2 blood pressure medications, says Dr. Laffin. The average American consumes 3,500 milligrams of sodium a day, far more than the American Heart Association recommendation. Because sodium is hidden in so many foods, avoiding sodium is difficult, unless you cook everything from scratch at home. Never eat out and avoid processed foods of any kind, including bread. But it's possible. It takes about 10 to 14 days to adjust to a low-sodium diet. Then some foods will begin to taste salty, says Dr. Laffin. Impact: if you have hypertension, limiting sodium to 1,500 milligrams a day should drop your blood pressure by 5 or 6 millimeters of mercury.
2. Consume more potassium. A diet high in fast foods, processed foods, carbohydrates, potatoes and meat is likely to be low in potassium, contributing to high blood pressure. A daily intake of 3,000 to 3,500 milligrams of potassium through foods such as bananas, tomatoes, and other vegetables is recommended. If you have significant kidney disease, you should be careful not to consume too much potassium, because your kidneys may not be able to eliminate it, says Dr. Laffin. Impact: if you have hypertension, increasing potassium intake to recommended levels should drop your blood pressure 4 to 5 millimeters of mercury.
3. Adopt the DASH diet. The dietary approaches to stop hypertension DASH diet was created specifically to lower blood pressure. It emphasizes fruits, vegetables, whole grains, and low-fat dairy. People who adopt the DASH diet usually meet low sodium and high potassium guidelines, and may lose weight as well. Research on this diet is so positive that it is now considered one of the most important non-pharmaceutical measures for controlling hypertension. Impact: the DASH diet can drop systolic pressure up to 11 millimeters of mercury. 4. Lose weight. Excess weight increases the likelihood of developing high blood pressure. More than half of U.S. adults are overweight. Losing any amount of weight is a good thing. Impact: every loss of 2.2 pounds should result in a drop of 1 millimeter of mercury in blood pressure. 5. Limit alcohol use. Men should limit alcoholic beverages to 2 drinks a day. Women should have no more than 1 a day. Impact: if you have hypertension and regularly drink more alcohol than recommended, reducing your intake may drop your blood pressure as much as 4 millimeters of mercury. 6. Get physical. Physical activity, specifically aerobic activity, is highly effective in reducing blood pressure. Aerobic exercise forces blood vessels to expand and contract, keeping them flexible. It also increases blood flow and encourages the creation of new blood vessels, among other benefits. Impact: doing 150 minutes of aerobic activity a week can lower blood pressure 5 to 8 millimeters of mercury.